34 people have now died from the Boksburg gas tanker explosion. The Democratic Nursing Organization of South Africa's Gauteng chairperson, Simphiwe Gada, has asked the health minister to allow nurses to wear black next week, as they will be remembering those who died on Christmas Eve during the blast there in Boksburg. The nursing union has also called on government to ensure that when repairs are done at the hospital, there shouldn't be any form of corruption. For more on this, we're joined by Simphiwe Gada, the Denosa Gauteng chairperson. Very good evening to you. Thank you so much for your time. I mean, a lot was said from Denosa this afternoon. And, of course, you speak as the death toll in that devastating explosion has now risen to 34. We had initially reported 9 of those who lost their lives to be healthcare workers. You attended the highly emotional memorial service today. What are your feelings and sentiments as a union?
Well, thank you for inviting us in the evening to the viewers. Well, today was the first step towards, fully accepting what has happened, fully accepting that we have lost colleagues, fully accepting that we have lost community members. So today we all gathered. I must say that, when you hear the news and you see what has happened at Tambo, sometimes there are those feelings of doubt that we experience as an individual. But today was part of that process where we could see now that actually we are not dreaming. Actually what we see and what we're experiencing is real. And that is why we then, when we woke up today, we had to ensure that, as we celebrate, we don't celebrate and be naive, but we must celebrate and also understand that during this dark period, there are those who are looking at the situation and wanting to use the situation to further their own selfish interest. And that is why when we spoke today, we indicated that, during a short period of time, we saw people who are not even qualified engineers already putting a figure of 18 million to be used to repair not all the damage, but just the cable at the hospital. I mean, I've done a walkabout in the hospital. I've been shown around the hospital. And that is why we saw that actually we have got to speak out now that, what happened at Charlotte Maxeke taught us that in the midst of a crisis, there are those who are always seeking to further their own corrupt objectives by ensuring that they steal from the poor. That is why you saw people coming out enthusiastically so, saying that 18 million would cost just to fix cables. So this is one incident, unfortunately for them, that will be watching close and that will be coordinated. We've been assured that it will be coordinated from the National Department of Health. So that is why you are saying that there will be no space for looting for those who are already queuing to loot. And that is why we have made that call today that we're not going to allow that taxpayers' money must be looted by individuals who see an opportunity in the midst of a national crisis. So that is what we are seeing. And also, we also made a call today that beginning Monday, we should declare a national or a provincial week of mourning by allowing nurses or all healthcare workers in the province, not just nurses, to don, their black clothes in honor of those that have lost their lives through this tragic experience.
Mm-hmm. Let's talk about the wearing of black. I mean, how are you going to escalate this and ensure that it does happen on a national scale?
Well, that is why we have said that in the province, that's the call that we're making, because we can only make the call in the province. Mm-hmm. That is why we've indicated to the leadership and the management of the Department of Health that next week nurses should be allowed, doctors should be allowed, everybody who works in the health sector should be allowed to wear their own black clothes just to mourn so that we can be able to, because the first process of healing is by allowing yourself to grieve, allowing yourself to mourn. I think, Mpo, you have seen that if you look at the date of birth of some of these professionals that we have lost, we are talking here about people who are less than 35 years, who still had a lot to offer in the health sector. So it is really an easy process that a communication must be made to all the hospitals in Gauteng that let's mourn those that we have lost. This is part of the healing process anyway, so there's nothing difficult about it. We don't think that is an unreasonable call, because while we mourn, we continue to provide services, being aware that there's kind of service that we render. It's a very important service that is located in the constitution of this country, because citizens of this country have got the right to access quality healthcare service, and as part of the oath that we've taken, we're not saying that we're in mourning and therefore we're not going to present ourselves for duty, but rather what we are doing is to ensure that, we continue rendering services. At the same time, we're also mourning our colleagues.
As you continue to render services and, begin to work within the grief that has taken place, as well as the psychological effects, how are you going to ensure that healthcare workers do really go and get some sort of assistance, psychological, psychosocial help? Because, of course, their state at the moment is one of shock. I mean, you describe the hospital and the community almost as one resembling a war zone.
Well, we are ensuring that nurses and all healthcare workers in our facilities do go for psychosocial support. By, for instance, yesterday we're going and ensuring that ward to ward, those who need that support is made available. As we are talking, the psychosocial support is on a continuous basis. I was having a chat today with some of our teams that are offering these psychosocial services, some of the chaplains. They knocked off at about 3:30 a.m. this morning. So support is ongoing as we speak. There are those who are going through that counseling. So we are satisfied from where we are as organized labor that indeed support is available, because we're not only looking at those who are working day duty, but our psychosocial support that is being offered is on a 24 hours basis. So at this stage, we are very much satisfied, and that is why part of the call that we made today was that the community surrounding the hospital should also be permitted to make use of those psychosocial support services, because we should not be selfish and only look at the staff only, but we should be able to understand that even those who are around the community are affected. And gladly, the management and the leadership of the provincial government does agree with us, and we are very much grateful. We must say this thing that we have had a very positive response from the private sector, from various stakeholders who are in the space of providing psychosocial support. All of them have really, came together and really demonstrated what South Africa is about, or what a rainbow nation is about. We have seen everybody, pulling towards one direction, ensuring that as a nation, we're able to move, and pick up the pieces from this tragic incident.
You say that you had a chance to inspect the hospital and how serious the process of repair may need to be. And in your call against those who may want to further their own so-called corrupt agenda, how do you believe would be the best way to go about it in terms of transparency as you make this call? And also, on top of that, you spoke about the lessons of Charlotte Matle. Again, of course, South Africa would remember the lessons of COVID-19 and what role corruption played there. Also, my second question, perhaps speaking to what could happen should those funds be exaggerated, and the impact it would have on the day-to-day runnings of the hospital and the patients and the staff.
Yes, what we have requested is that organized labor, as a neutral stakeholder that really wants to check if all the processes that are unfolding are not corrupt and we are abiding by the laws. In engaging the MEC of Health, Ms. Nomantu Nkomorale-Huku, we have all agreed that we are going to guard this process as closely as we can, and organized labor will be included in all communications, all meetings that must sit. And what is good is that the Minister of Health has also come in, and everything is being coordinated at a national level. So those who are in Gauteng, who are already eyeing this unfortunate incident as an opportunity to further their, corrupt objectives, have got another thing coming, because this will be coordinated through the National Department of Health, of which will be part of in ensuring that everything is transparent and we see everything. So we are confident that when we are given the space to also satisfy ourselves with every decision that is taken, then we'll be at a better position to prevent any corrupt activities, but also in dealing with the other question that you are raising. We have warned that you'll agree with me that in this country we've got a triple threat challenge of inequality, poverty, and unemployment, and added to that now is the high rise of the levels of corruption. And all these things, as they happen, ordinary people are hungry, the working class is hungry, is unemployed, and really what we're warning about as a threat to our democracy is the fact that, Frantz Fanon teaches us that when the working class can no longer breathe, the only solution is to revolt. And that's what we're warning about, that ordinary South Africans cannot continue to go hungry while those in positions of authority abuse the resources of this country. So we're really just giving a warning that in everything that public servants do, in everything that politicians do, they must understand that the majority in this country are those who are classified as the working class or the poor. And one day they will revolt, and when they revolt, this democracy will be threatened. And that's what we're warning about, because people are tired of witnessing people abusing public funds and so forth. And that is why we've made that call, and that is why we're going to ensure that the citizens of Gauteng will not be compromised because of corrupt people. Because as we speak, Charlotte Maxeke, yes, is functional, but not up to the capacity that we know it to be, because precisely of people who have got their own selfish, corrupt interests, who frustrated the process of restoring services at Charlotte Maxeke. And we are saying that an institution that is named after such a great icon, Oliver Reginald Tambo, which is called Tambo Memorial, should represent greatness such as that icon. That is why we're not going to allow corruption to happen in the midst of a crisis. And that is why we also want to take this opportunity and call upon the communities of Boksburg, the community of Ekurhuleni, to take ownership, because Tambo Memorial Hospital does not belong to the government, it belongs to the communities. They must make it their business that they know what is happening in Tambo, they know what is to be done, and they must be taken into confidence about every decision that is being taken to restore everything at Tambo. Yeah. And as organized labor, were ready and willing to support the management of Tambo and to guard against any corruption.
9 healthcare workers lost their lives. I mean, I would imagine that will have a serious impact on the day-to-day runnings of the hospital. How much do you know about how many more additional staff or perhaps nurses will need to be brought in to assist the hospital?
Well, at this stage, we keep getting daily updates in terms of the number of health workers that we're losing. But What we agree on with the department when we had a conversation with the management is the fact that from the cohort that has completed community service, in terms of nursing, those who are qualified, doctors and everybody, Tambo Memorial must be given maximum support, and we must be able to ensure that vacant posts at Tambo Memorial Hospital are filled so as to enable the optimum functioning of the hospital so that services are not disrupted. Because what is important is that we should understand that, given the location of that hospital, it's surrounded by an industrial hub. There are also informal settlements there. So you can't afford not to have Tambo Memorial Hospital running at a maximum level. So we have agreed that we're going to work around the clock to ensure that the posts which are vacant, which have been created by this unfortunate incident, including additional posts, must be made available to support Tambo Memorial Hospital. So we're happy with the commitment really that has been made, and we'll ensure that the commitment does not only become a commitment, but it must materialize into tangible something that will benefit the community of Ekurhuleni.
Yeah, absolutely. Thank you so much. Let's perhaps leave it there for now, and thanking you for your time, Simphiwe Gada.